This video shows how to don and doff personal protective equipment, or PPE, used for 2019 novel coronavirus. These guidelines are adapted from CDC guidance. Please refer to the written step-by-step instructions for donning and doffing PPE that are available on the Emergency Management webpage for more detailed information. First, long hair should be secured with a tie. If a bouffant is desired, don it now. If necessary, she can obtain a bag or box to store the reusable N95 and eye protection. She then performs hand hygiene with alcohol-based rub. Please note that the hand hygiene steps throughout this demonstration are abbreviated for the sake of time. Steph visually inspects all PPE prior to donning to assure that it's not torn or ripped. Steph chooses the appropriate respiratory protection, in this case, an N95 respirator. She should perform a proper seal check once the respirator is in place. Next, she should put on eye protection. For 2019 novel coronavirus, the face shield is the preferred method of eye protection to help protect the N95's respirator from contamination, but goggles are also acceptable. This demonstration uses a launderable gown ensemble. Steph puts on her gown, making sure it is secured and she is able to move unrestricted. She then dons gloves and ensures the cuffs are pulled down over the sleeves. She selects the correct size PPE, ensuring that the gloves fit properly. Steph makes sure she is comfortable and able to go through a range of motion while remaining correctly covered. And now she's ready to enter the room. As Steph exits the room, she knows her PPE is contaminated, and she should follow doffing guidelines carefully so she doesn't contaminate herself. Steph moves towards the door, gets an Oxivir wipe, and wipes down the door handle. Now, Steph removes her gloves. These can go into the regular waste. If using a disposable gown, break the gown ties with gloves still on now by grabbing the gown and pulling forward until they break. Steph should then remove her gown, being careful to touch only the insides of the gown. The gown should be turned inside out as it's removed. It can then be placed in the soiled linen hamper, or, if it's disposable, into the regular waste. Then, Steph will perform hand hygiene again. Now, she can leave the room. Outside the room, Steph should perform hand hygiene, and don clean gloves. Next, Steph removes the face shield or eye protection. Steph should now remove her respirator by tilting her head forward, grasping the bottom elastic strap first, then the top elastic strap and pulling them over her head. The respirator should be conserved by placing it into a container labeled with Steph's name. If wearing a bouffant, she can remove it now. The eye protection can be disinfected with an Oxivir wipe to be used again. Steph can now use Oxivir wipes to disinfect the outside door handle and any counter surfaces she used. Finally, Steph removes and discards her gloves and performs hand hygiene one last time.